a self-advocate's guide to respiratory illness, including RSV, the flu, and COVID. What is a respiratory illness?
A respiratory illness is a type of sickness that affects the way you breathe.
How do you get it?
Lung illnesses can spread from person to person through close contact, sharing forks, spoons, or personal items, and touching surfaces that a sick person has touched.
You may hear your healthcare provider talk about one of these types of respiratory illnesses.
Flu, pneumonia, asthma, bronchitis, COVID, RSV, and COPD. Sometimes these illnesses may look and feel the same. If you think you might have one of these illnesses, notice how you are feeling. Talk to your healthcare provider so that they can figure out what you have and how to treat it.
What causes a respiratory illness?
Viruses. The common cold, flu, and COVID-19 are caused by viruses. Viruses are contagious, can spread throughout the body, and cannot be treated with antibiotics. Bacteria. Some respiratory illnesses, like strep throat, are caused by bacteria. Bacteria is sometimes contagious, usually stays in one part of the body, and can be treated with antibiotics. Other factors include environmental, air pollution, cigarette smoke, and exposure to harmful chemicals. Allergies, pollen, animal dander, ragweed, and dust mites, and fungus and parasites, ringworm, roundworm, mold, and yeast.
Symptoms of a respiratory illness.
Coughing, sneezing, trouble breathing, wheezing, chest pains, and fever. You feel a respiratory illness in your nose, throat, lungs, and airwaves.
What do you do if you think you have a respiratory illness?
Take a COVID test, call a nurse for advice, stay away from other people, wear a mask.
How do you treat a respiratory illness at home?
Rest, drink lots of water, herbal teas or broth, take cold and cough medicine, use a humidifier, and stay away from cigarette smoke.
How can your doctor help?
There are some medicines that may help with viruses, such as the flu. These are called antivirals. Sometimes your healthcare provider can provide medicine for you to take.
How can you prevent getting a respiratory illness?
Get your vaccinations, wash your hands, mask if you are not feeling well, and open windows and doors for fresh air.
Where do you get a vaccine?
You can get a vaccine for some illnesses at your healthcare provider's office, at a vaccine clinic, or at a pharmacy like CVS or Walgreens. Contact the Disability Information and Access Line to learn more. Call 888-677-1199.
What are vaccines?
Vaccines are shots of medicine that help you stay healthier. They may prevent or lower your chance of getting sick as easily with a virus.
How do vaccines work?
Vaccines help teach your body how to recognize and fight off harmful germs. Vaccines use a weak or dead version of a germ that causes a disease. Vaccines prepare your body to defend itself and keep you healthy from harmful germs. Some vaccines may need more than one dose to work. Some may need a booster later on. Some vaccines may make you feel hot or cold, tired, weak, or sore after you get the shot.
These are antibodies. Your immune system makes antibodies to fight off germs. Weak germs help your immune system practice for the real virus.
This guide was brought to you by the Inclusive Healthcare Partnership Project, created by the Vermont Developmental Disabilities Council.